Welcome back to Marketplace Mastery. I'm your host, Michael Shellback. Today what we're going to be doing is taking that application that we just got and we're going to be putting it into the Marketplace system, getting their subsidy, picking their plan, basically getting this client out of the way and getting them insured. So the very first thing that you're going to want to do after you have their application is go to your Health Sherpa link. If you already have a particular link, please go to that link. If you don't, all you got to do is go to Health Sherpa and then go ahead and log in, which we're going to go ahead and do right now. So give me 1 second to get there. There we go. And then you're going to go ahead and log in if you're not already. You'll know that you're logged in because your name and NPN will be here and you'll have access to your dashboard right here. If it's not available, then go ahead and log in. If it's not your NPN, unfortunately, I'll be honest with you, be wary. I have seen that before. But if it's not your NPN, make sure you log out and log into yours. So what you're going to go ahead and do in order to put an application in is you're going to go to your dashboard. And then what you're going to do is you're going to see these two buttons up here, Start Application and Search Marketplace. Now keep in mind, yes, you can start an application fresh from right here, but what we always recommend doing is searching the marketplace first, because a lot of times you're going to find that this person already has an account with the marketplace, and searching is going to make your life a lot easier because it's going to import all their information. So literally it's going to go boom, boom, boom. You're going to be done in about half the time. So let's go ahead and search and see if this person has an application in the system. Give me 1 second. So you're going to put in their name, their date of birth, the state they live, and then you're going to attest that you have authorization to speak on their behalf. Now keep in mind, this is not the only way to search for an application. You can also search with healthcare.gov's redirect right here. In future modules, we're going to go over why sometimes you have to go this route. There are things that you can't do from this side that you have to use this one. But for an application, you can go ahead and just do it this way. Search the marketplace, and if he has an application, he doesn't. So if he did, it would be right here and you have access to just adding him as a client, and then you'd be able to open the application and make any adjustments if needed. But since he doesn't, we're going to go ahead and create a new application. We're going to wait for it to open up. And now we're going to go ahead and attest to two things: that we agree to have our information used and retrieved from data sources for this application. I have consent for all people. I'll list on the application for their information to be retrieved and used for data sources. Well, you're going to have to go ahead and attest to that, as well as I understand that I'm required to provide true answers and that I may be asked to provide additional questions, including proof of my eligibility of the special enrollment period if I qualify. If I don't, I may face penalties, including the risk of losing my eligibility for coverage. Okay, so now that you attested to both of those, we're going to go ahead and open up the application. You don't have to answer anything that is optional. So keep in mind, if it says optional, skip it. Okay, we're going to go ahead and answer all of this. Give me 1 quick second to enter all of this information. You do not need a social, as you see right here, but if you do not add a social, it is going to require you to send them a copy of their social security card, and it's also going to require copies of other certification for citizenship. So I always recommend adding the social if the person is getting insurance. If they're, let's say, a dependent, it doesn't matter. You don't have to ask for their social. You can just get their name and their date of birth. Okay, so let's go ahead and add his address. Then it's going to ask if it's not a permanent address or if the mailing address is different. If it is, you're going to go ahead and add the different mailing address. Email. So here's one thing that you guys have to understand. As we're doing this application, the system is automatically going to send the members emails. And some of the emails are a little confusing. So I always recommend telling them, listen, you're going to get emails from healthcare.gov as well as Health Sherpa. I recommend that you just disregard all of them and wait for me to respond back to you to tell you what the next step is. Because if you do the wrong thing, a lot of times these emails that are sent out may scare the client. Basically, they say things like, you haven't picked a plan yet, make sure you pick a plan, come here to make payments before you should. So there's a lot of things that these emails are directing that kind of confuse the member. So I always tell them, the emails you get from healthcare.gov up front, go ahead and delete them. If you get something in a month, maybe you should open it up. But right now, I'll take care of everything. I explain it as these emails are coming out as I'm doing the application, so it doesn't realize that I'm actually picking a plan. But trust me, when you're all said and done, you're going to have the plan picked for yourself. Okay, so now you're adding their phone number, type of phone number, whether it's a home or cell phone. I recommend that you always put home unless you want the marketplace text messaging your clients. I don't want that. So then again, written language and spoken language, you can change it to a whole bunch of different options. Continue. Now it's going to go ahead and sync with healthcare.gov, and it's going to ask who is applying for coverage. He is. Is he looking for healthcare savings? Sure is. Is there anyone else applying for coverage? This is where you would be adding a spouse or a dependent child. Keep in mind, the reason why they even have this question is because sometimes you'll be insuring a child, but you'll be insuring them through the parent. So let's say the parent's on Medicare and the child is 22 or 23 years old. With these plans, they can keep their insurance until 26. So if the parent's on Medicare, you would put that he's not applying for coverage, but other people are. So you would put the dependent's name here and their information. Again, if the dependent is getting insurance, you need their social. Perfect. So now, since there's nobody else, we're going to go on to the next question. And it's going to ask, are you married? No, he's not. Do you plan on filing taxes? Well, obviously, this is a tax credit. If you're not filing taxes, you're not going to be eligible for the insurance, rather the tax credit itself. Are you claiming any dependents? He is claiming a dependent. You're going to add the dependent's name. Date of birth is perfect. It's a male. Relationship is a child. Does this person live with you? Yes. Is there anyone else? You would add them right there. Is the child married? No, he's not. Does Jason live with anyone else under the age of 19? Anyone else? So that's the question. No, there's nobody else. Does William live with another person? No, rather it says parent. I'm sorry, these letters are small. And now we're going to go ahead and going over the social again, obviously. Then it says, have you used tobacco 4 or more times a week in the past 6 months? No. Are you a U.S. citizen or national? Yes. Are you currently incarcerated? No. Are you an American Indian or Alaskan Native? Nope. And then again, optional, optional. So we're skipping them. Okay, now keep in mind, if the person was, let's say, not a U.S. citizen, it's okay to push no, because the next question is going to ask you about eligibility, if you have eligible immigration status, and you would be eligible if you do have eligible immigration status. You can provide like a green card. See, a green card is a whole bunch of different things that you would be able to provide if you are not a citizen, if your client rather is not a citizen. But with this particular person, he is. So next. And now, is he a naturalized or derived citizen? No. And if you need to answer what that is, you can always click on these little bulletin boards, and it tells you exactly what they're looking for to answer the question. So this, guys, this isn't very hard. This is very self-explanatory. Same thing. Are you going to provide the child social? Nope, because he's not getting insurance. You don't have to worry about it. Is he Alaska Native? Nope. And again, optional, optional. So we're going to continue. Okay, so now it asks if he gets any income. Now it gives you a list if you want to see the types of things that you can count as income. It tells you what you don't have to count. So it literally tells you everything that you would need to know on the application. But again, you guys should be experts at that because we've been over that. Now, is he currently getting any income? He is. And what type of income does he have? He has a job. And again, it has all of these different options for income, right? But he has a job. Now, as far as the job is concerned, you don't have to put too much information. Just the name, the phone number, and the amount of money he makes a year. Now, remember, we're going to go with the lowered number so he can get the better benefits. And again, you can make this a year. Oh, it's right there, yearly. Perfect. Now you're going to save it. See, again, you don't have to add this. It's optional. Then it's going to ask, does he have any deductions? He does not. And then it's going to show you that his income is $25,800. Correct. Perfect. Now on to the next. And it's going to ask if William has any income. No, he does not. He has nothing here. And this is going to be a yes. It's zero income for William. I'd love to get my 13 or 14-year-old to start working. That would be great. Okay, so extra help. Again, optional questions do not need to be answered. So you can skip these two. Now here it asks, was he found not eligible for Medicaid or the Children's Health Insurance Program in the last 90 days? So, nope, that's not an issue now, for one, but at the same point, he hasn't. So we can go on to the next question. Did any of these people have Medicaid or CHIP that will be ending soon? No. So you're going to hit continue. Okay. And now it's going to ask information concerning an HRA account. You see these two questions? You'll need any information about health reimbursement arrangements that the people on this application may have gotten from an employer. He has none, so you can skip the HRA questions. He does not have employer-sponsored insurance. If he did, you would click that and find out that he's not eligible for coverage through the marketplace. Well, basically, you can't have coverage through work and, well, affordable coverage through work and also get a tax credit. Okay, will he be losing coverage before 6/7? Nope, he doesn't have coverage now. And normally, this is where you would add your special enrollment period. So if there is, let's say, a different special enrollment, like you lost your coverage, this is where you would add it. But again, because we are currently in a special enrollment throughout the entire country, well, through the federal marketplace, that is, he doesn't have to answer that either. And then, have any of these people been offered an individual coverage health reimbursement arrangements? Nope. So we can skip that also. Keep in mind, guys, once you get used to these, you're going to be able to fly through these applications. Now, for the most part, this is the summary. It tells you everything about the application that we just did. For the most part, you're always just going to scroll to the bottom and hit continue. Then you're going to agree. Okay, let's back up a step. You're going to agree that the coverage of renewal of coverage to make easier the determine my eligibility for paying for coverage in future years, I agree to allow the marketplace to use my income data, including information from tax returns for the next 5 years. The marketplace will send me a notice, let me know, or let me make any changes, and I can opt out at any time. So you're going to have to agree to this. The tax filer attestation. Now, this is going to be something that is applicable if someone's had insurance in the past. See, every year you get a tax credit, and they have to reconcile these taxes every year so they're able to get a tax credit in the following year. So you normally want to click this button, and that's going to say yes, they reconciled their premium tax credit for previous years. If the person has not filed their taxes yet, do not click this button, because what you're basically saying is yes, they filed and they have reconciled. Okay. Next page is about the last one. It's just going to be a couple things that you have to agree to, and then you're going to sign and you're done. So this is going to say, I understand that I'm not eligible for a premium tax credit if I'm found eligible for other qualifying coverage like Medicaid, the Children's Health Insurance Program, or job-based health coverage. I also understand that if I become eligible for other qualifying health coverage, I must contact the marketplace to end my marketplace coverage and the premium tax credit. If I don't, the person who files taxes in my household may need to pay back the premium tax credit. Pretty sick. So if you don't do this right, they can really end up with a lot of money owed. And this is the IRS, and they're not playing with their money. So the next one is going to say, I understand that because the premium tax credit will be paid on my behalf to reduce the cost of health coverage for me and my dependents, that I must file a federal income tax return for the year 2021. If I'm married, at the end of 2021, I must file a joint income tax return for me and my spouse. That's important. So people that are married must file as a joint return. I also expect that no one else will be eligible to claim me as a dependent. Remember that if you're a dependent, you can't also get a tax credit and be a dependent. I'll claim a personal exemption deduction on my 2021 federal income tax return for any listed on this application as my dependents who is enrolled in coverage through this marketplace and whose premium for coverage is paid in whole or partly by advanced premium tax credits. Okay, if any of the above changes, you have to make sure that you tell them, because you're going to have issues otherwise. I understand that it's my impact of my ability to get the premium tax credit. Sorry, it's really small. I understand that when I file my 2021 federal income tax return, the IRS will compare the income from my tax return with the income on my application. I understand that the income on my tax return is lower than the amount on my application. I may be eligible to get additional premium tax credit amount. On the other hand, if the income on my tax return is higher than the income on my application, I may owe additional federal income tax. Very simple. Like I've been saying, they're going to check your subsidy in the beginning. They're going to check it at the end. They're going to subtract it. They're going to see if someone owes money. If they owe you, they're going to pay you. If you owe them, you're going to pay them. That's it. It's as easy as that. You got to push yes. Now we're going to continue. Just about done. Okay, now we're going to be signing and submitting. So again, please read the attestations below and select the response for each statement. I know that I must tell the program I'll be enrolled in if information listed on this application changes. I know I can make changes in my Marketplace account or by calling the Marketplace call center at 1-800-318-2596. I know a change in my information could affect eligibility for members of my household. Got to agree. If anyone on your application is enrolled in Marketplace health coverage and is later found to have other qualifying health coverage like Medicare, Medicaid, or CHIP, the Marketplace will automatically end their Marketplace plan coverage. This will help make sure that anyone who is found to have other qualified coverage won't stay enrolled in the Marketplace coverage and pay full cost. That's big, because in years past, what they used to do is if they found that you were ineligible for coverage, they would just drop your subsidy, and next thing you know, your price would increase. And if you were, God forbid, on an auto pay, that price is going to go up and you're going to get deducted. I've seen it happen where they go from $15 to $1,000 and $1,000 gets taken from them and it takes a month to get it back. So it's a pain in the butt. So now again, you're going to sign this application under penalty of perjury, which means I've provided true answers to all the questions to the best of my knowledge. I know I may be subject to penalties under federal law if I intentionally provide false information. Okay, you're going to sign. I always copy and paste it. You want to make sure that you have capital letters. It is case sensitive. And now you're going to submit, and you're done. So with that being said, now what we're going to be doing is we're going to wait for the eligibility results, and we're going to put this member into the plan that they chose. Pretty simple. So we're just waiting for the next piece, and it says you will have effective date of 5/1. Eligibility letter, $478 subsidy is exactly what I calculated before. Choose a marketplace plan. So, again, exactly what we've looked at so far. And now we're going to go ahead and I'm going to filter out the silver plans. And we're going to choose a plan. Boom, $0, exactly what I told him. It worked out perfectly. Now, just so you guys can understand, there's a lot of different plans. I live in South Florida. There's 62 plans in the silver level alone. So I don't work with Blue Cross, but my selling point against it is it has an $800 out-of-pocket maximum higher, and the co-pays are a little bit higher with Blue Cross. This is Bright Health. Bright Health has two different plans here in South Florida. You may see this one here. Includes dental, but it's not the same plan. This medical network is much smaller than this plan, and I'm not a big fan of incorporating dental with their health insurance. So this is the plan that I sold. This is the plan that I'm going to enroll in. So we're going to add it to the cart, and then we're going to go ahead and apply these changes. Any more straightforward? And almost, but boom, boom. Confirm your plan. Just so you can see everything. This is the premium, deductible, out-of-pocket maximum. It says that you're qualified for the tax credit right here. Covered by the plan, enrolled. And you, my friend, are now enrolled. 5/1 effective date, and we are officially through. So I now enter this person into my automation system, get them going. But that's pretty much it. It doesn't get much easier than that. I hope this video helps you when it comes down to the submission time, but know that it doesn't get much easier than what you just saw. And again, I did it really slow to make sure that you guys are following. I read everything to you, but for the most part, you're going to realize where everything is, and it's going to be boom, boom, boom. And these applications take me 5 minutes to go through, especially someone like this who's only one person on the app. Okay, well, application is now complete. Until the next time, peace, love, and happiness. Have a good day.